Hi, Miss Rogers. I want to go over this discharge with you
Okay.
concerning you. Well, you know you had a DVT of your left lower leg, which they also call as a blood clot. I do have some doctor's appointments for you. So we're going to start with your anticoagulant clinic. This is for a follow-up. It's for February the 17th at 10:30 in the morning.
Okay.
You have a way there and everything, or okay. And then we also have an appointment with Dr. Smith, your provider. I'm giving you these cards for you to remind you of the time, and you know where they are and everything.
Thank you.
Okay. So now I'm going to get to your discharge medications. So if you're having any pain, the provider has ordered Tylenol 500 milligrams, and you can take that as needed for pain. We have the little printouts on the medication here. So, and it pretty much tells you, but like I said, it's as needed for pain, 500 milligrams. I believe it's
just 500 milligrams.
Yes, just 500 milligrams, and it should be like if you had pain. I'm just going to give an example at 12 o'clock. I believe it's like every 4 hours, but it's as needed. So you keep your pain level down. Are you having any pain right now?
No, I'm pretty good right now.
Okay, good. Thank you. And then he's also wanting you to have Lovenox, 80 milligrams. Now, that's an injection, and that's going to be taken once a day. I know. I'm going to show you. So here's all about Lovenox. But I do have this. I'm going to demonstrate for you on how to do this, because we like for that to be in your abdomen, in your stomach. And we want to do like 2 inches away from your navel is how we want to do that. And you want to just find an area. You're going to clean it with the alcohol prep. Let it dry. You don't want to fan it. Just let it dry a little bit on its own. It's only a couple seconds. And you want to pinch your skin. You've already got your needle because it's already pre-filled. You'll take the lid off. You go ahead and pinch your skin. And you want like a 90 or a 45-degree angle. And you want to go in and release, press the plunger slowly on in. And then you'll just remove it. And then that's all you're basically doing. And then you want to put it in a sharps container. You're going to do this once a day. This is the Lovenox. And what they're saying, they want you to continue doing that until your next follow-up appointment. And then they'll go from there to, possibly change over to PO medicine. But for now, they want you to do the injections. And then lastly, we have the aspirin, 81 milligrams. That's daily, once a day. All of this is, it prevents heart attacks, and it helps with strokes by reducing your blood clots. That's what we want to do. The Lovenox, that's used to treat your DVT as well, which is your blood clot. Let's see. Then we have dietary restrictions, and he puts you on a heart healthy diet. So we have information on a heart healthy diet here, where it's talking about, pay attention to your portion sizes, but you want to eat more fresh fruits and vegetables. You want to limit or reduce your salt, low fats.
So no fried chicken.
It's good I think every once in a while, but for the most part, I would say you want to bake it, broil it, like that. You want to limit the unhealthy fats.
Okay.
So that's what we're trying to do with that.
Right.
And your activity level, is as tolerated.
Okay.
But I do want to go over like some warning signs. So for signs of bleeding, which like if you easy bruising, if you notice any unusual gum bleeding or prolonged bleeding from a cut, and then like DVTs can further lead into, like if it breaks off and goes up to your lung, then that can be like pulmonary embolism, which you would have like this shortness of breath and a chest pain, and if you're coughing up blood. We want you to seek immediate medical attention if any of these signs occur.
Okay.
But other than that, do you have any more questions for me?
No, just take all the medications daily and then follow up with my appointments.
Oh, and I would like to remind you, like with your compression socks, you can wear them, especially when you're doing a lot of standing or if you're sitting. Leg elevation, you want to keep your legs up as well. But I think we're all set, and good luck to you.
Oh, thank you.
All right.
All right.
Thank you, Miss Rogers.
Thank you.